Hello, I am Tu Kim Lam. Welcome to the Medical News Show. In this edition of the Medical News, we will talk about the update news on constipation. According to the National Institute of Health, constipation is one of the most common gastrointestinal complaints in the United States. More than 4 million Americans have frequent constipation. Most often, our women and adults are age 65 and older. Pregnant women may have constipation, and this is a common problem following childbirth or surgery. About $725 million is spent on laxative products each year in America. Here with us today is Dr. Tran, who is currently practicing internal medicine in Falls Church, Virginia. He will share with us the information in gastrointestinal problems and update news on the constipation symptoms. Please welcome Dr. Tran.
Hello, welcome to our medical news shows. And hello, Mrs. Lam.
Hello, Dr. Tran. Today we're going to talk about one of the gastrointestinal problems, which is constipation. First of all, can you explain what is constipation and when it is being considered as constipated?
Constipation is one of the most commonly problems in medical fields, especially for the patient. And I believe that most of us also experienced sometime in the past, one time or many times, the constipation. So what really constipations? What are the definitions of the constipations? We have two different kinds of definitions. One from the patient. When they complain about constipation, they're talking about the changing in the regular habit of moving bowels. Means they moving their bowels less often than normally they do. And they feel like they have difficulty to empty the rectum and need to strain. They need to use force to move the stool out of the rectum. So these are the very much subjective symptoms of the patient when they express to the other people or to the physician. But in the medical term, the medical definitions, we base on the study on the constipation. And we use the definition of Rome 3. Rome 3 means we have different kind of convention about constipation in Rome. And so after so many time discussion with an expert in the world, then we come up with definition of the constipation. Constipation in medical term means need to strain over 25% of the time. Always have hard stool over 25%. And they move the bowels less than 3 times a week. And all these happen lasting more than 3 months. That is the definition of the constipation in medical term.
Dr. Tran, before we go further into the symptoms of constipation, let's talk about the large intestine because it has a major effect to the symptom. Can you explain about the function of the large intestine?
I think it's very important to understand the basic function, or we call physiologies of the large intestine or colon, another term of the large intestine. Now remember, in the gastrointestinal system of the body, when the food comes down to the stomach, they will moving after receiving acid, being a little bit metabolized in the stomach, the food will move down to the small intestine. And all the way to the small intestine, all the nutrient, on the carbohydrate, on the lipid, and all the protein, including vitamin, will be absorbed through the body to the lymph system. Now, at the end of the small intestine, we have the liquid form, they call wasting liquid form of the nutrient. Now, the function of the colon is because all the liquid will dump into the colon. Look at the pictures of the colon. You can see the colon is very long intestine. Usually measures about 1.5 meters. And moving from the right side, we call the ascending colon, and move across the abdomen called transverse colon, and move down to the lower part of the abdomen called descending colon, go to the last phase of the colon called rectum, and then anus is the one really have the sphincter to open up to have the defecation. Now, if you look at the process, you can see the first function of the colon is to absorb the water, to transform the liquid wasting material of the body into the solid one. So it takes time because the bowels were moving slowly and take about 12 hours to 24 hours to transform these liquid into the forming stool. So the liquid wasting material called feces, but the stool, when it formed, it called stool. So different. Now, what the other function of the colon? The colon is contain a lot of muscles in the colon muscle and the wall, so they can contract and push forward on kind of stool until the rectum. And the rectum, they have a special system in collaboration with all the muscles around the pelvic area. So whenever we feel like we have to passing stool, they call defecation, they have the coordination between the pressure inside, the contractions of the colon, and the contraction at the same time relaxing the sphincter of the anus before the stool can go down and passing out. So very simple, but very complex, very complicated physiologies of the colon before we feel like we're able to passing stool. Now simple, when we go to the toilet room, easy, I pass this stool, very easy. But really, when something go wrong, you can see how very complicated to fix that problem, especially when there's no contraction or the colon doesn't work anymore, then we have problem. Thirdly, is in the colon we have a large number of bacteria. They call normal flora. Doesn't mean a good, friendly bacteria. What is the function of bacteria? They have about 50 species in there. The function is to really decompose or really using on-carb enzyme in the bacteria to break down all the rest of the nutrient is left over to the colon. The first one, any carbohydrate like cellulose, lactose, starch will be break down. Now, if the body cannot do that, then for instance, if you eat some kind of nuts and the body cannot digest that, the body will release a lot of gas and causing flatus, and people really having a lot of gas in the abdomen. If the people cannot digest lactose in the milk, they could not do it, and then the body just move along and push the lactose out, causing diarrhea. So you can see how the bacteria is so important. The bacteria also to help to retain the vitamin K and really absorb the biotin is very important for the hair and the fingernail. Besides these things, very important because bacteria normally become normal for the body, but when they get out of the colon, becomes enemies of the body. For instance, if the person get a gunshot wound or any perforation of the colon, the risk of dying is very high because the bacteria become virulent and really they can kill people by causing massive infection called septicemia of the body. And most of the time, people usually die if they have some kind of wounds in the colon.
So what caused the symptom of constipation, Dr. Tran?
Constipation is just a symptom of a disease. So therefore, they have different kind of underlying causes. And remember, is for the Asian cultures, we always believe that people get constipated because they eat something hot, or the body has become hot. Only two things, either hot or cold. Now, they can catch the wind and get the constipation, but basically, scientifically saying, really the food we eat like ginger, pepper, either red pepper or black pepper also causing constipation. So be careful about that. The onion and garlic also sometimes eat a lot can cause constipation. And really it's, the cause of constipation besides what we believe in, but I think it's mainly it's not drinking enough waters. And secondly, it's not really eating enough vegetables or fibers. Fibers is very important because the fibers will retain the waters and help the body to form the stool based on that. And not enough exercise because the body also, the large intestine colon need exercise to stimulate the movement of the colon, make it stronger. And remember, it's most of the medication we use nowadays, especially in the elders. They use a lot of medication. Be careful, because the medication is the main cause of the constipation nowadays, because we use a lot of medication. Now, beside that, the body also plays a role, because the malfunction of one of the organs in the body, especially the thyroid, called hypothyroidism, also slow down on the process of the body and causing constipation. Depression, people depressed usually doesn't want to eat, doesn't want to really move around, and they really doesn't want to care about the body. Usually they develop constipation as well. Now, lastly, very important and need to remember is everything related to constipation could be related to cancer. The early form of the cancers is really the difficulty to move the bowels and changing the habit of moving bowels that they trigger and direct the physician to looking for cancer.
So you just mentioned that medication also cause constipation. Would you please tell us what are these?
Medication is very important to remember, because most of us using medication, including the over-the-counter medication and the medication we use prescribed by the physician. Now, the first thing you need to remember, any form of antacid, I mean, usually we do like Mylanta, Maaloxone, whatever, contain the calcium and the aluminum over the counter, may trigger constipation as well, including Tums. The second group is very important to remember is anybody taking hyperintensive medication, like amlodipine or anything contain the calcium channel blocker, like cortisone, nifedipine, also remember it may cause constipation. So please let the doctor know that you're taking this medication. Antidepressant to treat the depression is very common to cause the constipation. Any cough medicine containing codeine also causing constipation. And most medication using to treat pain and painkiller, usually having codeine in different level of amount, then also causing severe constipation as well. Now, the laxative used to treat the constipation, if you overuse that, then after the diarrhea or the constipation over, the patient develop constipation again. So they become more dependent on laxative. So laxative is very, very important. Also the key in causing constipation on people.
Dr. Tran, would you please talk about the pathophysiology of constipation?
Pathophysiology, that means when the function, normal function physiology of the colon become abnormal, we call it pathophysiology of the colon. Now what does this mean? It means the colon itself have some kind of function. They have two functions of the colon. The first function is autonomous. Mean the colon doesn't matter what you eat, they will work anyway. But then they will be controlled by the brain as well. So whenever we eat, the colon continues to move to form the stool. But at the end, the brain will signal and tell the patient that you need to move your bowels. So the colon under influence of two systems, the system inside the autonomous system, the outside is nervous system. So therefore, whenever the colon working, either goes so fast, causing diarrhea, or goes so slow, causing constipation. Now the second group of constipation causing by dysregulation of the system. People able to form a stool, but they cannot really move the stool out because either it's so weak of the muscle of the intestine, or the pelvic muscles is so weak, or the sphincter of the anus is really not open at the same time. So therefore, we have different kinds of disease, difficult to treat, especially happen to the elderly people bedridden, or people in nursing home, or people really have some kind of nervous system complication like stroke and causing these things. And lastly, it's very important, it's very common in young people, they call irritable bowel syndrome. Irritable means because the control of the nerves become irregular, and then people sometimes get diarrhea, and then next time they got constipation, and go out like that, and in cycle for most of their life. And usually we call irritable bowel syndrome. It's very difficult to treat, but that's really the entity of disease that need to look at to explain all the problem related to constipation.
Dr. Tran, so when would a patient need to visit the doctor for making a diagnosis of the condition of constipation?
Very important is when you have the constipations, you need to look at that seriously, because that's not regular things. And if the constipation is lasts more than 3 months, after using on laxative doesn't work, after trying everything it doesn't work, then you may have to see the doctor looking for some other real underlying problems. So that's very important. Or when you get constipation and you see blood and stool, or when you have the constipation and you're losing weight, or have frequent abdominal pain, then this signals something else could be related to cancer. That they call red flag symptom of constipation. You have to see the doctor to looking for some underlying problem.
So, Dr. Tran, how do you make a diagnosis of the constipation symptoms?
The diagnosis of the constipation is based on different things, based on the symptom we just talking about, and also based on the form of the stool. What is the form of stool? Because we have the standard to follow the form of stool, from very small, tiny, round, up until very big, large, or liquid. So if you look at the pictures on the screen, you can see different form of the stool. And then the physician will base on that to really guessing or try to figure out what kind of underlying colon problem that may be causing this. Like, for instance, if the stool is so thin, small, and long, most likely because the narrowing of the lumen of the colon. That's mean direct the physician to looking for cancer by using different tests. So this is very important. And also looking for the amount of coffee, alcohol, whatever the medication patient taking, to figure out whether it's related to medication or not, or any other medical problem, and then surgery of the colon, anything else, to make the right diagnosis of the colon problem.
Are there any new tests to identify these problems, sir?
Right now we have different testing because for difficult cases only. That's the first one they call colonic transit study. This means to study how long it takes for the colon to really move the stool down to the colon. Sometimes it takes about 24, 36 hours. We have the testing. The patient can swallow some capsule. With the trace in there, they can detect by the different machine and follow up with the X-ray, so we can measure how much it takes for the colon to move one item around to go out. And secondly, we have the test called rectal manometry to really measure the pressure inside, to really explain why the patient cannot really move their bowels or cannot defecate by himself or herself. By putting a little bit of instrument inside rectum and measure the pressure when the patient really is move the bowels, and to know exactly what the pressure inside. Now, when the patient cannot really move the bowel at all, they can use the balloon expulsion test. Means they have a little balloon inside the rectum and try to to tell the patient to try to really get it out. If they cannot get the balloon out, that means they cannot really move the bowel. So these are the very, not completely new tests, but it's really using for special cases. It's only done in a special institution around in the United States.
Dr. Tran, if it's, the symptom has left for untreated for a long period of time, what kind of health complication would it lead to?
I think it's very important because constipation is a simple symptom, but it can trigger frequent abdominal pain, sometimes causing obstruction due to the fecal impaction. Fecal impaction means when the stool is so hard and it cannot move out and causing blocking of the colon. Nothing come out of that obstruction. Can cause hemorrhoid in the anal fissura, and also when the patient forced to move the bowels all the time, it can cause rectal prolapse. And then also, lastly, when the build-up pressures inside the colon can trigger some of these small pockets in the chronic wall and causing diverticulosis. You can see in the pictures because the pressure inside keep building up and causing the defect in the colon wall and causing diverticulosis.
So how would you treat constipation symptoms, sir?
I think it's based on the information we just presented. You can see mostly you have to drink more fluid to keep the stool a little bit soft and not very hard. Exercise to stimulate the colon to work, and keep daily habit of having bowels after breakfast. Try to eat more vegetables and fibers. It's very important. This is a key success of any treatment for the constipation is try to treat more fibers and vegetable. Reduce coffee, and looking for any drug that may have side effect related to constipation. And this is very important. And try to eat more fibers. Nowadays, people always talking about fibers. We can eat in raisin bran, on bran, apple mango, prune juice, and beans, all kind. And people just focus on that. Mostly, we can treat the constipation very well with the natural measure. I mean, it's just food and drinking a lot of fluid, and that's it.
Are there any new medication for treatment, sir?
Before we talk about new medication, we're talking about different medication we use nowadays in the market. You can find any medication treating constipation over the counter. The first one they call poking agents. Poking agent means there's some kind of fiber like metamucil that have to absorb the water because they have the tendency to absorb 20 times the water is like a regular thing. And so they soon will form and easy to move. Second group is osmotic laxative. They can pooling large water into the large intestine to help to move bowels. And we have different things like the magnesium, sulfate, meal magnesium, etc., and helping to really move the bowels. The hyperosmotic laxative also like sorbitol, lactulose, and glycerin, or Miralax, also one of group. Then you can find over the counter to use that wisely, not to use it too long. And unless really the motion of the colon is very slow, then we have to use some kind of stimulant. That's Dulcolax. Dulcolax is over the counter. You can buy either suppository or buy the oral pill, and really to stimulate the bowel to move a little bit faster and stronger. And finally, if nothing really working, you can use enema. Fluid enema, they mean a form of fluid. You just insert into the rectum, and the fluid will break the stool into small pieces to help the patient to move. Now, these are the old and over-the-counter, very old traditional medication we use for century. But now we have the new medication called lubiprostone, the brand name Ametisa. The mechanism different because they will target the membrane inside of the colon. The membrane have the function to regulate the water absorbed or excreted through the mucosa of the colon. Now, this medication will target one of the channel, the chloride channel of the colon. When they target that, they will bring more water into the inside of the colon. So therefore, the stool always needs some water. It's not very high, very hard, or very dry. So that's the new medication. And right now, they have they get the FDA approval for treating constipation and also for irritable bowel syndrome that we just mentioned earlier.
Dr. Tran, I understand there's a way called biofeedback beside food and nutrition. Biofeedback is also another way to help treat constipation symptoms. Can you talk about it?
Biofeedback is using in different treatment in medicine. It just means it's just try to bring the patient back to the normal physiologies of the colon. That means the colon need more fiber, it need more water, and then need regular. So we had to train the patient to really move the bowel exactly the time that we want them to do, mostly about breakfast. Why breakfast? Because usually during the night, the IV system is slowed down. And after breakfast, they have the reflex called the gastrocolonic reflex. When we eat something, we move everything. So as soon as the food comes down to the stomach, then we move all the system, intestine, large intestine to move. So most of the time, after we eat breakfast, we feel like we need to move the bowel. So we train people to get that back to the physiology of the colon, and train them and advise them to use that at the normal the bowel movement for them to really retrain their body and try to control a little bit the movement of the colon.
Dr. Tran, before closing the show, what advice would you have for the audience about the symptom of constipation?
I think it's, as you already listened, you know, it's just fibers, vegetable, very important. Drink plenty of waters and regular exercise. Now, very important to avoid using laxative or any stool softener for too long, because if that happens, then you have to be careful. It's something else going on, and always you need to looking for the physician help to figure out exactly what's causing this one. I think that's the recommendation for today, and the message that we want all of you to remember is eat more vegetable, drink more water, exercise regularly, and avoid certain kind of medication that are unnecessary for your problem.
Thank you, Dr. Tran. That is all the time we have for Medical News Show. Thank you for joining us, sir.
Thank you for watching our show today, and again, thank you, Mrs. Lam.
You're welcome, sir. That was Dr. Sang Tran, who just shared with us the information on the gastrointestinal problem and the latest news related to these symptoms. We hope that the information provided by Dr. Sang Tran has shed more light on the gastrointestinal problem and to help in preventing further complication in this health issue. That is all the time we have for this edition of the Medical News. If you have additional questions regarding to this topic, please consult your family physician. I am Tu Kim Lam. See you next time on the Medical News. Until then, have a good one.